Administers the vaccine in the topmost layer of the skin. Its purpose is to reduce the risk of neurovascular injury. You'll need syringe, moistened cotton balls, gloves, and BCG vaccine in this procedure. For the considerations, ensure to use the right medication, check the expiration date of the vial, careful on injection through intradermal, and maintain sterility. Document time, date, location, and type of medication injected. Always screen clients for possible contraindications every time you administer a vaccine. Gather all necessary equipment. Check the expiration date of the vaccine as well as the vaccine vial monitor sticker to assess potency of the vaccine. Greet the child's significant others and inform the child's significant others for the procedure to be
I
done.
am Nurse Rani Saifisal, student nurse Rani Saifisal from MSU College of Health Sciences. Today I'm going to administer a BCG vaccine to your baby. Would that be okay? Thank you. Wash hands.
Wash hands thoroughly or use alcohol for sanitation before. Withdraw BCG vaccine from the ampule or vial. Swap the rubber top of a vial with sterile gauze or cotton balls. Remove the cap from the needle by pulling it straight off. Touch the plunger at the knob only. Draw back an amount of air into the syringe that is equal to the dose of medication to be withdrawn. Hold the vial flat on surface. Pierce the rubber stopper in the center with the needle tip and inject the measured air into the space above the solution. Do not inject air into the solution. Invert the vial. Keep the tip of the needle below the fluid level. At an eye level, hold the vial in one hand and use the other to withdraw the medication. Touch the plunger at the knob only. Draw up the prescribed amount of vaccine while holding the syringe vertically and at eye level. If any air bubbles accumulated in the syringe, tap the barrel of the syringe sharply and move the needle past the fluid in the airspace to re-inject the air bubble into the vial. Return the needle tip to the solution and continue withdrawal of the vaccine. After the correct dose is withdrawn, remove the needle from the vial and carefully replace the cap over the needle using scooping method. Recheck the amount of fluid withdrawn. Identify the patient. Clean the skin with a cotton ball moistened with water and let skin dry. Hold the child's arm with your left hand so that your hand is under the child's arm and your thumb, and fingers come around the arm and stretch the skin. Remove the needle cap with the non-dominant hand by pulling it straight off. Hold the syringe in your right hand with the bevel and scale pointing upwards. Lay the syringe and the needle almost flat along the child's arm. Insert the tip of the needle into the skin, just the bevel and a little bit more, keeping the needle flat along the skin and the bevel facing upwards so that the vaccine only goes into the upper layer of the skin. Put your left thumb over the needle end of the syringe between the index and the middle finger of your right hand. Gently push the plunger to inject the correct amount of vaccine. If the vaccine is injected correctly, a flat wheel with the flat surface pitted like an orange peel will appear at the injection site. Withdraw the needle gently, do not put pressure on the injection site, and leave as it is. Provide health education and necessary teachings to the child's significant others. Advise the child's significant others on return and follow-up vaccination. Do after care. Perform hand washing. And document the procedures.